Good evening, everyone. It is my honor to welcome you all for this 134th episode of podcast series, a great initiative by our Fogsi president, Sunita Tandulwadkar ma'am, who has also initiated various other projects like Sampurna, Arogya Yogyatra, vaccination drive, and also study on adolescent obesity. So now in this podcast series, I, Dr. B. Kalpana, Fogsi Infertility Committee Chairperson, will have a conversation with Dr. Sampath Kumari ma'am, past Vice President Fogsi, and also past Adolescent Committee Chairperson who had been associated with the educating adolescent girls and boys for almost a decade and also has got strong future plans. So, almost 46,000 gynecologists are Foxy members are watching this podcast series, and the reach is beyond gynecologist, even into common public, adolescent girls, boys, and their parents. So, it is my honor to introduce our Foxy president, Sunita Tandulwadkar ma'am, who doesn't need any introduction, but for the completion's sake, it is my honor to introduce her. Sunita Tandulwadkar ma'am, Foxy president,
Kalpana, it is your day with Sampath.
is ma'am, who is leading a fertility consultant and endoscopic surgeon from Pune. Ma'am, requesting you to give your blessings and words of wisdom for this podcast.
Thank you. Thank you, Kalpana. And it's so nice to see that you invited Sampath Kumari, very dear friend, for this podcast so that Sampath, you are in our Star Pravaha podcast series. It's lovely to have you. Kalpana, I'm thankful to you. Kalpana, you are a very methodical worker, very sincere and honest. And whatever you think over, you always do it with the sincerity. I appreciate that. Sampath, this program was curated completely for the committee chairpersons because I saw the way webinars and all were going. I was not much happy. They have to struggle to get the faculty. No one attends those in spite of so much effort. So I decided, ki, let's change completely. And these are our future vice presidents and presidents of Foxy. So they become a leader when they interact, when they have their creative mind used. Best of the leaders they get to interview. So automatically they will grow. But believe me, today is 133, Kalpana.
134.
34. And I have heard 134 faculty, and I think it evolved me as a person. It was so amazing to listen to so many leaders, academic, non academic, global backgrounds, politicians, social worker, the amount of work people do is amazing. And I'm thankful to each and every committee chairperson for taking this Pravah program so seriously, so seriously. They do their best. So today, having Sampath, it will be a great honor to us. And important thing is Sampath, after she greets you, I join from the viewer link, and you both stars will be the stars of Tamil Nadu, the stars of South India, uh, only having their Pravaha dialogue going on, and we all will enjoy listening and watching both to both of you. You both are looking so beautiful, well dressed, and ready for Pravaha. I can see the way Kalpana is. That is beauty of it.
Thank you,
Thank you.
Sunita. But it's really a good opportunity.
Thank you.
Thank you.
Over to you, Kalpana.
Thank you so much for your blessings and encouragement, ma'am. Now it is my honor to introduce Sampath Kumari ma'am, who is also well known in Pan India, immediate past vice president and past adolescent committee chairperson. And currently, she is the founder secretary of TNFOG, president of OGSI, and also Senate member of Tamil Nadu MGR Medical University. Her work in adolescent health over a decade is really a great thing. And it is our honor to have you here, Sampath, ma'am.
Thank you, Dr. Kalpana, for inviting me, and my thanks on the just to Dr. Sunita, madam. This is the 134. I think 134. I am lucky to be the participant in this on 134. We will have a good dialogue. Thank you, Kalpana, for selecting me on the subject which I like, that is the adolescent health. Thank you. We will start.
Yes, actually,
Sampath, you are such a hardworking and sincere lady. Anything, so much dependable also. Anything I need, emergency, the chapter or anything, automatically the name comes in my mind is Sampath. I give her a call. Sampath, I need to do this in a week's time. She never says no. I give her a module to do. She says, yes, I'll prepare it and send it to you in a week's time. So that Sampath Kumari, she is going to be definitely a future leader because you need to be dependable. You need to be an academician. You need to know how to lead various organizations. And Sampath, you have all the qualities of it. Thank you.
Thank you, madam. All you are the inspirator. Thank you.
So now, adolescent health is gaining so much of importance nowadays. Can you please tell us the problems adolescent girls or boys face in this critical period? And we will discuss in detail one by one.
Yes, Kalpana. Thank you. See, today the adolescent, as all of us know, as per WHO, that is the age from 10 to 19 is the adolescent. They are classified as early adolescent, middle adolescent, and late adolescent. And during this adolescent, they have a lot of problems. Mainly, they may have the mental health and about the nutrition, what is good and what is not good. They may be having the about even the sexual health. Sexual health, it doesn't mean that only the pregnancy. Starting from the menarche up to that, what are all the complications and what are all the problems and about the teenage pregnancy, how the pregnancy can happen. And again, sometimes they may have about obesity and what are all the problems due to obesity and the vaccination. So there are many problems which the adolescents, they don't know and they do not know where to get the information. So I think we will have a one by one, what are all the problems they have, and let's try to bring some clarifications to them. Thank you.
So, as you started with mental health, actually, many of our children, when they are crossing 10th standard, 11th standard, or 12th standard, they undergo lots of stress, probably because of goal-oriented or sometimes because of hormonal changes. They behave little differently in that critical period. How do we tackle them, and what is the advice to the parents in this critical period?
Yes, this is the nice questions. The mental health. See, this is from the puberty. Mainly the hormonal changes happens in that boy or a girl. They themselves do not know what is menstruation and what is how the problem will be, what is the breast growth. And during, as you told that during 10th and the 11th, 12th standard, they are always under tension. See, previously it was that everyone should become a doctor or engineer. Now there are many fields are open. Still, they do not know which field they are going to be. So they themselves will be tensed up. And the parents, they should understand what is the change happening. The girl sometimes she will be sleeping long time and she may not be going to the school. And when they go out, usually you would have seen that door, they will close like the sound which will everyone can hear. So the parents should be in a position to identify the changes, what happens with their adolescent girls or boys. So in that case, we should talk to them. And what is the problem? What is the friends? Sometimes from the peer pressures also, they may have some problems. So the parents should identify the changes that are happening in the adolescent and try to talk to them. See, the first thing I usually tell the adolescents, they don't like advice. So you should give all information, whatever is possible. So don't get tense. If you are not if you are not able to recollect in one time, means read the subject twice or thrice. Like that, you should talk to them. Suppose even if the girl is having some friend which the mother may not be liking, that also you should put a word and tell them what are all the complications that can happen. So you should identify the changes from the adolescents and try to give them more information about the change and what complications can happen. So you should be a friend. The mother should be a friend to the girl and the father should be a friend to the boy. Such way, they will talk to the parents openly and it will solve many problems and they will be free from the stress also. That is the way we should mainly advise the parents.
Yes, actually, this is a difficult task in that period. So, coming to adolescent nutrition, many a times they are overfed to compensate, or sometimes the girls are under eating to maintain their body shape. What is your advice on this for adolescent girls and boys? Or sometimes they go to gym and overwork, take so many supplements to maintain their body shapes.
Yes, regarding the nutrition. See, for example, when we were adolescent, we will have 3 meals, morning breakfast and afternoon lunch and night dinner. Nowadays, the girls or boys, they go to the school very early and they will try to avoid the breakfast. So the nutrition, whenever we talk about the nutrition, we should better to stress about the breakfast. So what is breakfast? Breaking the fast. The night they are not taking anything and they are sleeping. So we should counsel them to have the breakfast. So if they don't take the breakfast, it will disturb the carbohydrate metabolism. Because of this disturbance of the carbohydrate metabolism, that itself will produce obesity. So again, coming to the breakfast. Previously, the breakfast was like the solid foods. As all of us will be taking idli, dosa, whatever, chapati. But now there are a lot of fast food, some noodles or the bread, whatever it is. So they can take this type of fast food monthly once or twice, not daily. If they are going to take this type of fast foods daily, they are having only the empty calories. So it is mainly the parents. We will come to the parents only. Regarding the nutrition, the adolescent, this is during the period of adolescence only, the bone mass, skeletal mass, muscle mass, everything is happening. So they need equal distributions of the carbohydrates, fat, protein. So the adolescents should be counseled to have more of fruits, vegetables, greens, and milk, whatever is needed. Even if it is in the non-vegetarian, they can have the iron-rich diet. Now you see, whenever I am going for the school adolescent counseling and taking, if ever we do the hemoglobin, now our Sunita madam is doing that program. No? So we are doing in the school also the hemoglobin level, the Sampurna project. Most of the girls, they have the hemoglobin less than 10. See, when a girl age is 12, the hemoglobin should be 12 grams. If we don't correct this, it will lead to complication, as all of us know, anemia complicating pregnancy. So the iron-rich food, that is also to be given to the girls. Always, even if the adolescent girls comes to our clinic, the doctors, they should not talk about take this like that. You should have a colorful pictures. What are all the iron-rich foods? What are all the protein diet? And you can tell them, these are all the diet which you should take frequently. And some foods, whatever the fast food or pani puri, pel puri, don't tell them that you don't take that foods. You can advise them to have it monthly once or twice. If you tell don't take pani puri, don't take pel puri, they will get irritated and they will try to have it daily. So this is the way the nutrition has to be stabilized for the adolescent girls. Always fruits, vegetables, and milk and iron-rich food. 3 meals, 3 snacks, 30 minutes exercise. So that it will maintain the normal calories needed for the adolescent. Normally, it can be 1,200 calories per day. So this is the way we counsel the nutrition. Then I'll come to the other point. See, sometimes what they will try to keep up the figure. Say, if we take most of the food, we may become obese. In that conditions, they will avoid many food. And even if they are hungry, they will not take the food. You would have seen the girls sometimes taking the food, and then that anorexia nervosa, bulimia, that and all, they will try to vomit out. So in these cases, now normally the adolescent girls, when they get up, first thing they will do is they will see there in the mirror to see how it is. So the nutrition, the way we are counseling, they will be easily understanding what are all the foods to be taken and what are all the foods to be taken to certain extent, nothing to be avoided.
Yeah, on the other extreme, adolescent obesity is also becoming more common. Even our Fogsi president is also doing a study on adolescent obesity. Probably as parents, are we concentrating more on scores, especially on 10th and 12th standard? And as a working professional, are we skipping proper diet, and are we not encouraging the children to go for proper exercise? And what is your opinion? Because adolescent obesity is a dangerous thing and that would affect her future fertility too. What is your advice on it and how to tackle this?
Yes, this is good. The obesity, yes, as I told, see, now we were talking about the breakfast, lunch, and the dinner. So breakfast will be all will be in the hurry, and lunch or some parents will be taking in the office, and the students will be having in the school. Night dinner, I always advise all of them should sit together. The parents, brother, sister, and the night dinner should be taken. And during that time, the parents should take advantage to talk to the children. See, the obesity, always what if you tell them that if you take pani puri, you will become obese. If you take ice cream and sweets, you will become obese. Like that, rather than that, if you become obese, what will happen? See, if a girl is, all of us, we know that the body mass index, a BMI. What should be the BMI when the girl is of the height and the weight? So we should talk in a manner that BMI is maintained. See, if you are going to be overweight, that is 40 kg or 45 kg in the age of 16 years, you may have some disturbances. What are all the disturbances you may have? As you go obese means there may be a carbohydrate metabolism disturbance, and you may go for diabetes. Like that, if you don't do the exercises, you gain the obesity will be increasing. What are all the complications of obesity? Example, PCOS to diabetes, diabetes to metabolic problems, obesity. Some people will do the work earlier. If you are obese, you cannot do the work earlier. So in the simple languages, the languages that should be used with the adolescent should be in their terms. You cannot expect the adolescents to come to our level. We should go to the level and talk to them, and you should have patience. You talk to them very politely and tell that if you are becoming obese, you cannot run. And similarly, the exercise, 30 minutes exercise. See, if a girl is doing the 12th standard and if you are asking her to go for walking and swimming, means she may not have time. She may be having the board exam. So in that type of cases, you can tell during that exam times, the simple exercises, which they can avoid the escalators and the lift, and they can use the staircase. And similarly, they can do the sit-ups. See, in the US, the sit-up exercises, they are telling as per literature that will increase the memory, which we are doing for our Vinayaka. So they can do 30 times the sit-ups. Like that simple exercises, which the girls can do. If they are going by the bus or car to the school means, we can ask them to get down in the previous stop and walk for 10 minutes. During that walking time, they can recollect whatever they have written. Similarly, the skipping and dancing, these are all the good exercises. So for want of the school exams, they should not skip the skipping and the dancing exercise. So if they are maintaining, as I told earlier, 3 meals, 3 snacks, and 30 minutes exercise. The simple exercises, if they do means, again the obesity will be reduced and they can maintain. Always the BMI should be maintained with the 20. So we should teach them what is BMI, what is their height, what is their weight, how it can be maintained. See, first, suddenly from the 20 kg, they are not going to become 40 kg. So slowly they will be increasing, the way it will be increasing. The parents should identify this is the stage when they are becoming obese. In that stage, they should talk to the children and give many fruits and vegetables. See, if you are talking about the nutrition to the adolescent, it doesn't mean that only that girl or boy should have that only. That they will be having fruits and vegetables, and the parents will be taking the pani puri and bhel puri. The whole family should cooperate. That is the way we can have a good, smooth rapport with the adolescents.
Yeah. But is it really needed to talk about fertility to an innocent school-going adolescent girl? How much they will be receptive for that?
Yes, we will start from this word obesity itself. In the obesity, we are talking about that this will be, other girl will be always, the skinny people. You can quote the example. See, for example, see Nayendra, how she is slim. If you are obese, no one will see you like that. From that incident, always we should quote the examples which the adolescents like. So if they are obese, again, the fertility can be a problem. From there, we can start. Nowadays, this era has changed. Now that we have to talk to them about the fertility. So this obesity itself will produce an ovulation. So in that case, we have to talk to them about ovulation. What is menstruation? How is ovulation happens? From the ovulation, how pregnancy happens? Like that, we should talk. So if the girl, they may not be knowing what is ovulation and what is fertilization. Some girls, they don't even know how they will become pregnant. In the school counseling, one of the girls, she asked me, if my boyfriend kissed me, can I become pregnant? So we have to talk to them about the fertility. Nowadays, they should not learn everything from the media, that is from the TV and from the friends. The mother should take an opportunity and talk to her about what is pregnant, puberty, how the bleeding will happen, what is the normal flow, and when the ovulation can happen. And the mother must be knowing. If she is not knowing, she can help it from the others. So how the mother, boy and girl can become pregnant. These are all the things which can be, even in the school, if you go for the school teaching, the teacher, suddenly the reproductive chapter comes, means they will go very fast. It's not like that. You should talk to them, put everything. 1 plus 1 is 2. That is mathematics. But our obstetric is 1 plus 1 is 3. So we should explain how this 3 is coming. So this is the way that we have to talk. Nowadays, many of the people, they go for the pre-conception counseling. It is not only for the conception. So during the adolescence, whether they are having any metabolic problems, whether they are diabetic, whether they are parents, normally the children and father and the grandparents. 1 minute, Kalpana, I will switch off the cell phone and come. Only 1 minute. So we should cover how the metabolic problems happen. So it is better to talk to the adolescent girls and boys. We think that the boys know everything, but the boys, some boys, they do not know even what is masturbation. Sometimes some sweating, something is coming, whether it is a disease, he doesn't know whom to ask. So that is also to be explained. The boys, not only the girls should be counseled, even the boys. What is masturbation? It is normal only. Many boys will be having the same problem. Like that, the parents should teach them. Similarly, in the school, the reproductive chapter. Nowadays, we are telling comprehensive health care. It is normally comprehensive sex care also. But the teachers should explain what is masturbation. If the adolescent, if they have confidence with the person whom they are talking, it can be a teacher or it can be a parent or it can be even a doctor. Some girls, they will not talk to the mother or father. They will come to my clinic and they will ask. They are telling that I have some PCOS, whether it is a disease. So what will happen? If it is a problem, means the mother will ask many questions. So if they have confidence on you, they will come out with all the problems. For example, I will tell, since you are asking about the fertility, one of the girl was asking, one of my friend, classmate is like my brother. I lost my brother. Can I talk to him as thinking that he is my brother? See, these are all the questions with the children. So we should tell it is not at all possible. Brother is different, friend is different. So the fertility issues, how the pregnancy can happen, what are all the complications can happen, what are all the types of adolescent abortions that is happening. Sometimes if they become pregnant, they do not know where to get the tablets. So the fertility, about the fertility, it has to be talked to the adolescents earlier, mainly by the parents and the teachers.
So then, when should we start educating the girls and boys about reproductive health? It should not be too early, or it should not be too late also.
See, many people may not be liking what I used to tell. Whenever the girl is attaining puberty, whatever the age, that time itself we have to talk about the reproductive issues. It's not, as I told, it's not only the sex, about all the problems. See, the girl, when she attains menarche, puberty, previously it was about 12, 13 years, 14 years. Now, even in the age of 10, they are becoming, it is not a precocious puberty, normal puberty. They are at the earlier age. So some girls, they may not be knowing how to use the diaper and how to use the cloths. That is starting from the menstrual hygiene to the pregnancy is the reproductive health. That is the study. So from the puberty itself, we can start. When a girl is having the regular puberty means what will be the normal flow? It will be about 3 to 4 days. And if it exits beyond 5 days, and how many pads they are using. These are all the questions which is needed. They may be using many pads and they may become anemic. Because of the anemia, they may not be able to concentrate on studies. So when from the puberty itself, we should talk. They will be very anxious to know what is pregnancy. Sometimes if one of her friend is having the boyfriend and she may tell that about the boyfriend. Again, they want to experiment. So if you talk to them about what will happen, what will be the flow, what will happen if you don't have the 2 months of the bleeding, it can be what pregnancy or whatever it is. So you should talk that yeah, according to me, from the age of 10 itself, we can start the sexual health studies and the reproductive health studies, all about the menstrual problems. We will deal one by one.
Yeah. Yes. Actually, PCOS had been overdiagnosed in adolescent girls with some scan finding. Also, patients do come to gynecologist asking about the details of PCOS. When we tell them they should go for lifestyle modification, otherwise their future fertility, they may need some assistance. But the parents become too anxious. They sometimes even think that whether the child is fit for marriage, and how to counsel them and how to make them understand this is a lifestyle disorder.
Yes, Kalpana. This PCOS, nowadays it is diagnosed. How to tell? It is overdiagnosed. Rather than diagnosed, it is overdiagnosed. Rather than the children, the parents are matured. See, the parents should understand with the ultrasound, the PCOS cannot be diagnosed. So the PCOS mostly 90% is with the obese. We were talking about the nutrition and obesity. So the adolescent, the parents should take care that the obesity is one of the reason we should counsel the PCOS. And most of the time they come with a scan report and they will ask whether my daughter can get married, whether she will have children. The PCOS, they will Google it and what are all the maximum complications, they will think about it. So the PCOS, the doctors, whoever is dealing, we have to tell that they in the adolescence, unless they have the bleeding irregularity, whether it is due to the anovulation and sometimes have growth in unwanted places, they are only the PCOS. Otherwise, it is not at all a disease. You cannot diagnose it with the ultrasound itself. So that has to be told to the parents and the treatment also. As soon as seeing the ultrasound alone, that most of the time they are not going to be started. Sometimes they may go to them, they may be from the periphery and they may be in the village. They may not have a huge knowledge. With the ultrasound, they will be studying it is like a necklace pattern. They are telling that it is a PCOS. So in that, the lifestyle modification is the only treatment for adolescent PCOS. So we have to tell if there is a bleeding irregularity and if there is hormonal levels can be disturbance. Sometimes the male hormones, the hormones which is for the boys may be present in the girls. So that history we have to talk to the parents. If the bleeding is normal and if there is no androgenic features, don't bother about it. Only the lifestyle. Lifestyle, 3 meals, 3 snacks, 30 minutes exercise. This snacks also only vegetables. So first we should teach the parents that PCOS is not a disease and it can be corrected only with the lifestyle changes. And sometimes the girl may be having the parents having the diabetes. In that cases, if they are having any blackish coloration, acanthosis nigricans, in that cases, we can tell it can be due to the insulin resistance and the fasting and the postprandial. It doesn't mean that we are going to do all the investigations. PCOS, we are going to know what is needed only. If a girl comes to rule out, you can do the blood sugar level and the TSH. And if there is a amenorrhea history, always we are going to rule out the pregnancy. That directly we are not going to do. Since they are coming with the ultra scan report, that itself we can tell that it is not there. So the PCOS, the counseling the parents is very, very important. It's not at all a disease, only the lifestyle changes.
On the other extreme, we also encounter patients, adolescent girls with endometriosis. We counsel them about the possibility of reduced ovarian reserve and maybe once they reach somewhere around 23, 24, they can get married, and early pregnancy is better if they have a huge cyst. So even when we counsel extensively about reduction in ovarian reserve, many a times they are ignorant and they concentrate on their projects and also profession. This is the other extreme of patients we always encounter. So how to counsel them, ma'am? Even after counseling, they are little resistant only.
Yes, nowadays they want always they want to be a number one in their profession, and sometimes they want to go abroad and finish their studies, and then they come back and they want to get married. I think you are all infertility specialist, and you may be dealing lot of the cases. So this ovarian reserve, as you are telling about that, so we have to tell them that as age goes on, there may be a problem. This ovarian reserve is nothing, that is the eggs that is produced by your ovary. So we will try to counsel that as far as possible, get married at the age of 29 or whatever they wish. Many times they may not be interested in, they would have decided one thing means they will expect us to tell what they want. So this about this ovarian reserve, we can tell them how we can find that ovarian reserves. Sometimes the antral follicles also, we are not going to do for the adolescent girls and only for the sexually active, only vaginal examination. We can tell about the AMH. And if at all needed, they can be monitored with the AMH and see how is the ovarian reserve is there. And as far as possible, try to counsel. Otherwise, they would have Googled out what is the result for this ovarian reserve. So what they are expecting, we have to talk. It is not what to say. It is possible to talk to them about what is the ovarian reserve, when they should become pregnant, or if it is going to be less than 0.3, what will happen? So if they are not going to get married and if they are not going to become pregnant in this stages means, it is better to monitor their ovarian reserve with the next question they will ask, how I will monitor my ovarian reserve. So it is better, as far as we knew with the AMH, they can do. Then what are all the recent advances, they will come out. In that time, we can talk to them about what is the recent advances about, suppose some patient will be having some drugs. Some patient, in that cases, it is very, very needed. Some cancer patient. In that case, we ourselves will go for the freezing and like that. In that and all, no need to talk to them. The girls who are concentrating on project and profession, first is counseling. Try to counsel. If they're not going to listen, then go for the recent methods.
So now, what are the myths or false belief parents or adolescent girls or boys having at present, and what is the truth in contrary?
Regarding
Reproductive health.
reproductive health, many is the myth means the first itself is the PCOS. That itself is a myth. If there is a PCOS, there is no child. That already we have talked and cleared. Again, the next thing they will be asking about when they can have the sex and what will be the sex, how to have. Now, previously we used to talk about good touch and the bad touch. Nowadays, safe sex and unsafe sex. And they may be asking if I am sexually active. Well, some girls, they will come and tell, I cannot live without the sex. So how I can prevent from the pregnancy? These are all the myths they can have. They will be in an idea. If I can use some injections, there may not be the pregnancy. So we should clear the fact. If you have the condoms and the other method only, you can avoid the pregnancy. Sometimes the condoms may not work also, and they do not know. Sometimes they may not be using, no, do not know how to use the condom also. These are all the myths using the condoms and the pregnancy can be avoided. And as I told previously, if the boy kisses me, can I become pregnant? This myth has to be clarified. And STI, sometimes they may be having that we have to clear. If I go with the boyfriend, if I go and have a cup of tea, whether the STI can affect me. So that only with the sexual intercourse, the sexually transmitted infections can happen. These are all the basic myths and the many myths the parents will be having. That has to be clarified. They may be asking different questions. According to the questions, we can answer it. Sometimes the patient, the child will be having a pain during the menstruations. The parent will come and ask, because of this pain, what will happen? And some of the time they will tell this pain will go when they go for the normal delivery. These are all the methods. So the what is the pain, how it is occurring, that has to be clarified. The pain, they can take water. Sometimes it may lead to some gynec problem also, the pain. So the myths, according to the questions, we can clarify the myth.
What is your opinion about social egg freezing, which is a very controversial topic?
Repeat, Kalpana. I am not able to hear.
Social egg freezing.
Social egg
Freezing.
freezing. Yes, that only I was telling previously, the recent advance. So now they are seeing in the movie, no. In the movie, they are seeing, from the media, they are seeing. If they don't talk, they're able to get the information from the parents or teachers. They come to the doctors also. They will ask about what is this egg freezing. See, I can do this freezing methods and I can get married once my project is over, profession is over. Even if they get married, they will get an opportunity for a job in abroad and they don't want to have the pregnancy now. And they will be thinking about why don't we freeze the egg and the sperm now itself. And after 10 years or whatever year, they can now their movies are some very big heroine also doing, that itself they will be knowing. And they will come and ask. See, to certain extent, we can avoid the egg freezing and all. You can do it. But if it is not essential, don't proceed with this. This is mainly for girls who are having that medical treatment. If they are having some malignancy, before the treatment, we can do this egg freezing. For that purpose only, it will be useful. But sometimes it will be very difficult to counsel the adolescent. In that case, if they are not only the adolescent, even if they are getting married, in that case, we have to tell that it will be useful and you can go for that. So they will be very particular about the profession and project rather than the pregnancy. Compared to 3Ps, they will pay project and profession only. The third P, they are not at all important. Nowadays, many adolescent girls, they don't want to get married. Even if they get married, they don't want to have child. That we have to streamline them. Otherwise, it will be very difficult. We can frankly tell about this egg freezing, what is the advantage, what are all the disadvantage. Then if in later life, if you want to have something means that one pregnancy or two pregnancy, whatever is possible, that can be told. So the social things, if they have clarification, it is our duty to clarify all the scientific questions and doubts they are having.
Many a times, social media gives lots of information without any strong evidence on it. So there is no regulatory body also. How to be choosy, which one to trust on behalf of parents or adolescent girls, I'm asking.
Social media.
Yeah.
About social media, means, see, now we can tell the social media, it is always a double-edged sword. See, with this, many positive things can happen, and with this, negative things. When there was during the COVID, that is 2020 period, even the school classes were taken only by that media only. So there are some positive points that can be done. Sometimes with this, the unnecessary problems are some girl and a boy, they are having the sex and they want to experiment, and all the habits. The one of her, not only the boys, even the girls, they may be having the smoking habit and alcohol habit. This habit from the social media. This point also we should count. Previously, we were talking about the fertility, these points that also will going to help in your reduce your fertility preservations. So the social media, the positive points, similarly the parents, that too during the adolescent period. Rather than this, the father or the mother, they may not be knowing the password of the children, but the mother, they will be knowing the password of the mother. So somewhere or other, you should try to take out the password, and we should see what are all the things they are seeing, what is the channel they are syncing, what is the link they are going, and we should find out what they are doing, because they may not be knowing. Many of the adolescents, they don't know about the complications, and they don't know where to get the informations. Even if suppose if a girl is having sexually active, and if she were, whether can the girl go and tell the mother that I am a friend, this is my boyfriend, I want to have sex with him. Which mother will accept this? But as per statistics, 60% adolescent girls are sexually active. That is the reason they are getting the information from the social media. So nowadays the era has changed. The mother, if she is sexually active, means if she comes to the doctor, previously from the servant to the HOD, everyone will scold the girl if she comes with an unmarried pregnancy. Nowadays it is not like that. So if the girl, if she is wanted to have the sexual activity, means we should counsel. We should talk to them about the contraceptions, what are all available. Always have the safe sex. Say, rather than learning from the media, it is better to learn from the parents and the teachers. The peer pressures, they also don't know what is going to happen. They also learn only by the experience. So, in the movie, they will tell boy and a girl going for a party and they have a juice and immediately they become pregnant. So that is not the story. That story has to be explained to the girl that with the single juice, you cannot become pregnant. The boy will first follow you. Then he will ask you to come to the room. Then only the dating. So what are all the negative impacts that happens that has to be talked to them? So many information they should not learn from the social media. They should learn from the parents. Otherwise, most of the time they trust gynecologist. See, I was working in Tiruvannamalai. That time I was staying alone. I'll go to all schools. Almost all the schools I have covered. 2 to 4. If I go to the school again second time after fourth month. First for 4 months I will go to the school, and the second round after the 4 months. The headmaster, the teachers and the principal, they will tell my students have changed after your visit and giving the counseling. So repeatedly I was going to the schools. 2 years I was doing all the schools I have covered 5 times. But there was many difference. So they trust the doctors, that to the gynecologist. If we talk to them in the way they can understand, definitely the social media impact will be less. Now, always I used to tell the adolescents are like a glass. If you handle them carefully, you can make beautiful things. If you don't handle them carefully, it will be broken into pieces. So always handle them very, very carefully like a flowers.
So we have been talking about adolescent sexual health. How to involve boys into our educational system, or to teach them about adolescent sexual health, because teaching adolescent boys is also really important.
Yes, definitely it is also needed, boys. As I told, the pink movie, no means no. That's all. That is the term I said. The norm, even for the girls and the boys. The adolescents should know, understand when they should know, tell to know for which things. It is not with the parents or the teacher. If a boy is following, she should talk to him that I have lot of commitments. I want to become so and so. So you wait till I become. If it is really love means he will wait. So the girl should be in a position to tell no politely and with refuse things in a polite manner. And similarly, the boy. The best example nowadays I'm quoting is the Pink movie. Even if it is your girlfriend or even if it is a professionalist, if the girl is telling no, you should not touch that. It is sex is not only having the intercourse between the boys and girls, physically, emotionally, whether she is willing, that consent is very much needed. So the boys counseling, always when you do the counseling in the schools, you do the counseling separate for the girls. First and all to start, that is during my adolescent committee chair, the first year and all I was doing only for the girls. But once they come, one of the teachers, she asked, the boys are telling madam, what this madam is always talking only to the girls. After that, only I have started doing the counseling. If you are doing counseling for 10 times to the girls means, at least one time the boys should be counseled. As I told, they don't know what is masturbation. And the habits, smoking, alcohol, we think only the boys are doing. The girls are also doing. We cannot tell don't smoke, don't take alcohol. If you smoke, what will happen? If you take alcohol, your liver will go. So like that, what are all the negative impacts? If you told the boys, most of the time they think our only if you have the smoking and if you have a girlfriend only, I am a boy. That is the opinion of that. Similarly, the girl, they will tell that boys are coming behind and me. But if the girl will be very happy if 4 boys are coming behind her means I'm so cute. So these are all the only the hormonal effect. So we should counsel them. That is even the adolescents, boys. It is the hormones which secretes on you, produces that it makes you to see the girls. That is the female attractions, everything. So always try to control your hormonal effect. Concentrate on. I used to tell the examples of Abdul Kalam. Always dream, dream, dream what you want. If you counsel in this way, I think it will be useful for everyone. If you counsel like this way, they will concentrate on their studies. See, you can tell them to throughout the life you are going to enjoy this. So you become a position, then you do all these things. So the boys will also listen. It is easy to counsel the boys rather than girls.
Yes, we have been talking about sexual activity, and please tell us about the regulations we have, because nowadays the crime activities and POXO, can you please enlighten about that? Because the regulations are very strong. The adolescent boys and girls should also know about it.
Yes, definitely. This is the boys and the girls definitely should know about the POXO Act, which was created after the Nirbhaya Act. Whether the girl or the boy, the girls should not have, that is, even it doesn't mean that only the intercourse between the boys and girls. If the boy is commenting the girls, whether she is giving following also, if the girl goes and give complaint to the police, if she is less than 18 years, and if the boy is following her and doing some teasing or like that, that is the POXO Act. It doesn't mean only the sex of the boy and the girl, even the teasing and even the giving some comments also. So the boy should also understand if he is going to have sex or if he is going to comment anything also. If the girl is less than 18 years, they are punishable. The girls, they should understand that if they go and complain to the police, the act will be taken. And sometimes the girls will be very afraid and they do not know if we go to the police, it will be a problem in our parents. And again, it will be a problem. It is not at all like that. And if you go to the police, it will go to the court and it will take many years. According to the POXO Act, before 18 years, if the girl comes and complains, immediately the action will be taken. Within 24 hours, they will have talked. And the court also, it is not with a separate court and separate judgment. They will have a local judgment and the judgment will be given within a month itself. Not only within a month, within a week. So the girls and the boys should know that POXO Act will release support for the girls. And the boys, they should know that they are punishable if they are going to end up with that is immediate imprisonment. And similarly, our doctors, we must be knowing about the POXO Act. If a girl comes with 18 years and if she tells that I have no, sometimes UPT positive also, we should not avoid. First, we should inform the police, and then what is the treatment needed that has to be given. POXO Act is supportive for the adolescents, and all the adolescents should know about the POXO Act. If they are less than 18 years, they can go on complaint and immediately action will be taken.
And the importance of sexually transmitted infection and its impact on future fertility. Can you please stress on it? Because this is really important for the girls to understand.
Yes, first, as I told earlier, the safe sex is nowadays I don't, I'll ask we cannot put a direct questions. Who are all your friends? But she will tell somebody, do you have any boyfriend? Whether a single friend or multiple friend. So if you put the leading questions to the girls, or even if the boys comes also, we can ask the leading questions and they will come out with the truth. Yesterday I had sex with a boy. So we should talk to them. If you are going to have a sex without the condoms, he may be having some infection. Similarly, that infection can be transmitted to you, sexually transmitted infections. As all of us know, we have to tell this sexually transmitted. Suppose this girl is having affected by the HIV or VD that will affect the future fertility. And sometimes you may have the disease also. If you are going to have the disease, you cannot have. Sometimes they may not have, if she is going to become an HIV positive, means how she can go for a marriage. So sexually transmitted, always the adolescent should be counseled. Privacy. Privacy is very, very important. So that if in the privacy only we can talk to them and see if you are having the sexually transmitted infections, you may be having the white discharge. Because of this white discharge, in future you will have a lot of that chlamydia, trichomonas, whatever the infections can be present. So this will affect your in future fertility. Fertility is very, very important after the marriage. So rather than advising them not to have sex, advise them to have the safe sex with the condoms. That is the sincere advice. Other than that, nothing can be done.
And coming to substance abuse, it is not uncommon in our country, especially in adolescent girls also. And how to control or educate the girls and boys to avoid and to be careful about the substance abuse.
About?
Substance abuse.
Substance abuse. Substance abuse nowadays, even in the 9th standard boys in the schools, it is similarly like that. The substance abuse, the parents and the teachers should talk what will happen if he is using cocaine or whatever it is happens. What will happen? The studies will be disturbed. Our future is lost, and her because of the substance abuse, all the systems it is disturbed. So it is very difficult to identify from where they are getting this substance abuse. So rather than that, we can talk to them about the complications. See, we cannot tell who is the best friend, who is the bad friend. So the parents should be in a position to identify whom the children is talking to them. See, if we know about the friends, and we can identify easily, these friends are going for the alcohol, substance abuse and everything. There are some students, they will be concentrating only on the studies. There are 3 types. So if our children is in which group, we can tell how the problems will happen. So where they are getting that, it is very, very difficult to find out where they are getting the source. But we can counsel our children to not to be friendly with the children whom they are having the substance abuse. It is better to inform the parents. That is the person who is using the substance abuse. Go to the parents. All children are equal. So, and we can tell, and to the teachers or the principal and everywhere we can tell. Substance abuse has to be avoided. Otherwise, the whole career is lost.
Now, HPV vaccination drive is going on in a large way under our president's initiative. So, what is your advice to adolescent girls and their parents about HPV vaccination message?
I think the human papilloma virus, as all of us know, it is the cause for the cervical cancer. So only simple, the HPV vaccine adolescents, 9 to 15 years, have 2 doses with 6 months apart. If it is more than 15 years, have 3 doses. Nowadays in Tamil Nadu, the government has sanctioned, I think 36 crores or something for the HPV vaccination. In my medical college, I have made HPV vaccine. Our medical college students are crossed to 15 only. But house urgency and final year, I have told that if you don't have the vaccine, I will not give the completion. So all of the final year students and the house urgents in my college, third dose is over yesterday. So the HPV vaccine is very, very important. So the adolescents has to be given HPV vaccine before 15 years, 2 doses, and after 15 years, 3 doses. And the mother, she has to be screened. That 90, 70, 90. Adolescents, 90% should be vaccinated. 70% women has to be screened. Whoever screened has to be treated 90%. This way in 2030, we can reduce that because most of the women with the cervical cancer are dying and they don't even come for pap smear. So the vaccination alone can reduce the incidence of cancer cervix. Anyway.
So,
Now this vaccine is available even for boys to prevent the penile cancer or throat cancer. They can also be used.
so what is your future plans to improve adolescent health?
Future plan. Individually, we cannot do everything. So we should use the celebrities and we should use the politicians and everyone to take care of the adolescents. And now we are doing online counseling for all. That is, within a week, we are counseling more than 1 lakh. If you have a good adolescents only, we can have a good nation. So India's population will be 30 to 40% in future. The adolescents are more here. Throughout the world, India has the highest population of the adolescents. So the counseling and teaching the adolescents should be done by everyone. The parents, NGOs, teachers, and celebrities, everyone should be united to, you can have a good adolescents. Health is the world wealth. That is my final decision. Okay, Kalpana, thank you very much for giving me these opportunities. And I should thank Sunita madam for doing this program continuously. Today is 134, I think. Share tremendous energy. We should get inspired from Sunita. And thank you, Kalpana, for the topic which I like. You have selected me. Thank you.
Thank you so much, ma'am, for the information. Really, it will be useful for the adolescent girls, boys, and also parents. Finally, it is my responsibility to thank Sunita Tandulwadkar, ma'am, Fogsi president, who had given wings to chairperson and given this wonderful opportunity. Thank you so much.
Thank you.